the Prince George's County Monkeypox virtual town hall discussion, sponsored by and hosted by the Prince George's County Health Department. Thank you so much for joining us tonight. This will be a very insightful session. We've got a great panel for you. We've got Dr. Ernest Carter, who is the Prince George's County Health Officer. We have Henry Bishop, who is the Administrative Chief for the Health Department's HIV and STD prevention. And we've also got a representative from the Prince George's County Public Schools, Dr. Tracy Jones, who is the Supervisor for Nursing Services at PGCPS. My name is George Lattis. I am the Public Information Officer for the Prince George's County Health Department. I'll be your moderator this evening. I wanted to let you know that if you have any questions during the town hall, please find the chat feature on your Zoom screen and type in your question. And what we'll do is we've got some folks behind the scenes that are helping us to filter those questions. Some of those questions may be answered during our presentations, and some of those questions may be asked to the panel at the end of their presentations. So we've got an hour, and I want to respect everyone's time. We're going to start with Dr. Ernest Carter, Prince George's County Health Officer. Dr. Carter, if you could show us your business-like face right now. Thank you for the suit. I've got the polo on, but that's okay. So Dr. Carter is going to give us kind of the rundown of what monkeypox is, how it spreads, how to prevent it, and much more information about vaccination and testing and things of that nature. So Dr. Carter, whenever you're ready, I am going to go along with you in the PowerPoint presentation that everyone can see. And then whenever you're ready, Dr. Carter, let's go ahead with it.
Thank you, George. I appreciate it. And good evening, everyone. Thank you for joining us. I just want to quickly go over what monkeypox is, how it spreads, and the symptoms that you could expect if you happen to get it. I'll also talk about testing and treatment and vaccination. So let's start with what is monkeypox. First, I highly encourage everyone to head over to our dedicated website for monkeypox. It's at health.mypgc.us/monkeypox. There you'll find the latest updates and guidance on this virus. You will also find information about vaccination appointments and CDC resources. The general public is still at low risk for getting monkeypox. There are, in the United States, 15,909 reported cases and no reported deaths. So monkeypox you're at low risk primarily for getting monkeypox, although it's starting to spread a little bit, but not at a high rate. Monkeypox can make you sick, but unless you have complications, most people who get it experience mild symptoms and do not need to be hospitalized. Now, let me just talk a little bit about how monkeypox spreads. Monkeypox can spread to anyone through prolonged contact, skin-to-skin contact. That happens through direct contact with the monkeypox rash, sores, or scabs. Transmission can also occur if you touch an object, fabric, and surfaces that have been used by someone who has monkeypox. You can also get monkeypox through saliva from a person with monkeypox. This contact can happen during sexual contact. This includes oral, anal, and vaginal sex, or touching genitalia or anuses of people who have monkeypox. Transmission may also happen during prolonged hugging, massaging, kissing, and talking closely. Well, let's talk about what the symptoms look like. Monkeypox symptoms usually start within 2 weeks of exposure to the virus. The first symptoms might feel like the flu. So you'll have a fever, headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, tiredness. Within 1 to 3 days of these symptoms, most people develop a rash or sores on almost any part of the body. These sores look like little pimples and blisters that may be painful or itchy. And the sores may appear anywhere on the body. The sores usually go through several stages before they get completely crusted over and fall off. It usually takes about 2 to 4 weeks, and that ends the infectious period. So from the time you start with your symptoms to the time the rash completely crushes over and goes away, you're infectious. The health department highly encourages residents to speak to their doctor or to a provider if they are showing any feelings of these symptoms, or if they have any questions, or they think they have been exposed to someone with monkeypox. If you have an unexplained rash that looks like a pimple or a sore, avoid sex or being intimate with anyone until you've been checked completely out, and avoid events and parties that involve close skin-to-skin contact. Now let's talk about testing. If you have an unexplained rash, you should also, one, call your doctor and ask about getting examined and tested. If you test positive, you must isolate until the virus has fully resolved and scabs have fallen off and a fresh layer of skin has formed. This usually takes about 2 to 4 weeks. If you do not have a doctor, contact a medical provider to ask about testing. The health department is only able to test people on a very limited basis. We do not have the resources or capacity to test people on a large scale at this time. We're talking with the state to possibly develop a larger testing operation. Now let's talk about how you can prevent monkeypox. Avoid close skin-to-skin contact with people who have been diagnosed with monkeypox or have a rash that looks like monkeypox. Do not touch the rash or scab of a person with monkeypox. Do not kiss, hug, cuddle, or have sex with someone with monkeypox. Avoid contact with objects and materials that a person with monkeypox has used. Do not share eating utensils or cups with a person with monkeypox. Do not handle or touch the bedding, towels, or clothing of a person with monkeypox. And wash your hands often with soap and water, or use an alcohol-based sanitizer, especially before you eat or you touch your face or when you use the bathroom, and keep all your surfaces clean. It's really important. Let's talk about treatments. There are no treatments specifically for monkeypox viral infections. Monkeypox and smallpox are genetically similar. They respond to an antiviral drug that was specifically made to fight smallpox. So you'll see sometimes people will use that drug against monkeypox. The health department does not have the resources or capacity to offer these treatments at this time. We're working with the state of Maryland to be able to do that, and with the CDC and our neighboring counties to coordinate efforts to minimize the spread of the virus. Let's talk about vaccinations. The Maryland Department of Health is in charge of providing local health departments with vaccine. Right now, our county, Prince George's County Health Department, has a very limited supply and limited capacity. Therefore, we have limited appointments. Please check the appointment schedule on a regular basis on our monkeypox website. It's at health.mypgc.us/monkeypox. The following high-risk individuals are eligible for a vaccine. Number one, patients who have been identified as close contacts to a laboratory-confirmed monkeypox case through contact tracing investigation. Number two, presumed contacts who meet the following criteria. Those who know that a sexual partner or who are known to have had a sexual partner in the last 14 days was diagnosed with monkeypox, they can get a vaccine, or those who've had multiple sexual partners in the past 14 days in a jurisdiction with known monkeypox. We will not vaccinate anyone if they have monkeypox or have monkeypox symptoms. If you have symptoms, contact your medical provider for evaluation, testing, and treatment options, and isolate at home. Once we get more vaccine, more groups will be eligible. The health department has been working with the state to develop a vaccine appointment pre-registration list. Stay tuned for more information on this in the coming days. Now, specifically about our vaccines, the health department uses Jynneos vaccine for monkeypox. The CDC says it prefers this vaccine to protect folks against monkeypox. It is a 2-dose vaccine given 28 days apart, and it's a safe vaccine. it takes 14 days after getting the second dose of Genio soap for it to have to reach its maximum immune protection. Now, there's another vaccine brand called ACAM 2000. It's an older brand of vaccine. It was primarily used against smallpox. It has a lot more side effects than Genio, so we don't recommend it. The state doesn't recommend it. It's called ACAM 2000. It's not recommended for people with severely weakened immune system and several other conditions, including eczema. Intradermal vaccination is going to, we're starting to do intradermal vaccination, and it's going to be required that we do that in this, starting next week. Our clinics will be giving vaccines given with this intradermal method, which will start to increase the number of available doses that we have. The CDC and the state health department have given clearance to use this method. The intradermal means that splitting up one vaccine vial into 5 doses. And what that allows us to do to give 5 more people the shot when we were doing intramuscular, we'd only give 1. So this, it really helps. And based on the data, the intradermal method delivers the same immune response and protection to the patient. So we're happy about that. That really helps us increase the number of vaccines we can give. Now, our healthcare providers, the primary care providers, will be able to vaccinate patients when the supply increases especially now that we're using the intradermal method. Providers will not need special vaccine storage conditions like they did with COVID vaccines. Physicians and other healthcare providers are getting additional guidance from the state about vaccinating, testing, and evaluating more patients. So they are going to be a tremendous help for us to get people vaccinated, especially in the coming months. So I'll stop there. I look forward to your questions, and thank you very much.
All right, thank you very much, Dr. Carter, for that, all that information. You'll see on your screen that we have started a monkeypox call center where you can get information updates and the latest guidance, and we will be updating that as much as we can when new things come about. So spread that number around to your networks, 301-883-6566. All right, so I'm going to stop sharing my screen, and we're going to go to our next panelist. Henry Bishop is the administrative chief for the health department's HIV and STD prevention program. So Henry, he's going to talk about some of the things related to monkeypox and HIV and STDs in general. So Henry, if you are ready, I will turn it over to you.
Yes, I am. Thank you, George. I've been asked to talk about HIV and monkeypox, or dispelling some myths that we've encountered recently regarding HIV and monkeypox, the relationship between. So I've been asked to respond to 5 questions. So I will start. The first one is, what is the difference between monkeypox and a sexually transmitted infection? Well, monkeypox, of course, is a rare disease caused by infection with the monkeypox virus. Monkeypox virus is part of the same family of viruses as variola virus, the virus that causes smallpox. Monkeypox symptoms are similar to smallpox symptoms, but milder, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox, and monkeypox spreads in a few ways that Dr. Carter may know, but I just go over them briefly. Close or intimate contact. Monkeypox can spread to anyone through close personal or often skin-to-skin contact, including direct contact with monkeypox rash, scabs, or body fluids from a person with monkeypox. Direct contact with monkeypox involves if you touching objects or fabrics, clothing, bedding, or towels, and surfaces that have been used by someone with monkeypox. This direct contact can happen during intimate contact, including oral, anal, and vaginal sex, or touching the genitals, penis, testicles, labia, and vagina or anus of a person with monkeypox. Hugging, massage, kissing, prolonged face-to-face contact. Touching objects and fabrics during sex that were used by a person with monkeypox and that have not been disinfected, such as bedding, towels, fetish gear, and sex toys. A person with monkeypox can spread it to others from the time symptoms start until the rash is fully healed and a fresh layer of skin has formed. The illness typically lasts for 2 to 4 weeks. A pregnant person can spread the virus to their fetus through the placenta. It is also possible for people to get monkeypox from infected animals, either by being scratched or bitten by the animal, or by preparing or eating meat or using products from an infected animal. You can also transmit monkeypox to your pet. The next question that I was asked to respond to is, why can't MPX be compared to HIV? Well, the reason is the human immunovirus, HIV, is a virus that causes HIV infection. HIV causes acquired immune deficiency syndrome, or AIDS, the most advanced stage of HIV infection. HIV is spread through contact with the blood, semen, preseminal fluid, rectal fluids, vaginal fluids, or breast milk of a person with HIV. In the United States, HIV is spread mainly by having anal or vaginal sex or sharing injection drug equipment, such as syringes or needles, with a person who has HIV. Another question is, tell me why MPX is not an STI. Monkeypox can more accurately be described as a sexually transmissible. In other words, sex is just one of the ways that monkeypox can be spread. In the past, monkeypox outbreaks have been linked to direct exposure to infected animals and animal products, with limited person-to-person spread. In the current monkeypox outbreak, the virus is spreading primarily through close personal contact. This may include contact with infectious lesions or respiratory secretions via close, sustained, skin-to-skin contact that occurs during sex. However, any close, sustained skin-to-skin contact with someone who has monkeypox can spread the virus. The contact does not have to be exclusively intimate or sexual. Another question that I've been asked to respond to is monkeypox an STI? While sexual encounters are currently the predominant mode of transmissibility among reported cases, monkeypox is not a sexually transmitted infection. Sexually transmitted infections are spread primarily through sexual contact, while monkeypox can spread through any form of prolonged, close contact. Close contact that transmit the monkeypox virus involves encounters that are typically more intimate or involved than having a sexual conversation. Than having a casual conversation or standing next to someone in an elevator. Transmission requires exchange of mucosal fluids or direct contact with the virus in sufficient quantity to seed an infection. This could occur through physical contact during kissing or cuddling. Because sexual encounters involve direct skin-to-skin physical contact where bodily fluids may be exchanged, these close contacts can transmit viruses more easily. Recently, monkeypox DNA has been detected in feces and various body fluids, including saliva, blood, semen, and urine. But the presence of viral DNA does not necessarily mean that the virus can infect someone else. Transmission from these sources is still under investigation. Other modes of transmission may play a greater role outside the MSM community. Household transmission, where individuals may come into close contact with infected people or contaminated items, is one of the most common types of exposure. Research is ongoing into the potential airborne and respiratory droplet spread of monkeypox in the current situation. The next question I was asked to respond to is MPX or monkeypox a LGBTQI plus disease? At this time, data suggests that gay, bisexual, and other men who have sex with men make up the majority of cases in the current monkeypox outbreak. However, anyone, regardless of sexual orientation or sexual or gender identity, who has been in close personal contact with someone who has monkeypox is at risk. Young men, mostly age 18 to 44, account for the majority of cases, and over 97% identify as men who have sex with men. Some super spreading events, such as pride events associated with air travel, international gatherings, and multiple partner sexual encounters, contributed to early transmission of the virus. Are HIV positive individuals more at risk for severe monkeypox illness? Anyone of any age or sexuality with or without underlying health conditions can get monkeypox. A person who has close contact with someone with symptoms of monkeypox is at the highest risk. Children, pregnant women, and people who are immunocompromised are more likely to develop more severe illness. People with undiagnosed or advanced HIV may be more vulnerable to severe monkeypox and require more treatment and support to recover fully. The CDC doesn't know if having HIV increases the likelihood of getting monkeypox. Monkeypox can spread to anyone through prolonged, close, personal, often skin-to-skin contact, as well as contact with objects, fibers, fabrics, clothing, bedding or towels, and surfaces that have been used by someone with monkeypox, or contact with respiratory secretions through kissing or other face-to-face contact. CDC continues to monitor monkeypox among people with HIV. During the current monkeypox outbreak, there does not appear to be more severe monkeypox illness in people who have HIV and are virally suppressed, which means having less than 200 copies of HIV per milliliter of blood. In fact, the World Health Organization monkeypox guidance states people living with HIV on antiretroviral with suppressed viral load are not considered to be immunosuppressed. However, people with HIV who are not virally suppressed may be at increased risk for severe illness and death from monkeypox. Thank you.
All right, thank you, Henry. We appreciate that a lot. Thanks for that insightful information about HIV, STDs, and monkeypox. Okay, so our third and final panelist will be Dr. Tracy Jones from the Prince George's County Public School System. She will discuss some of the prevention measures that all of us can take as we send our children back to school in about a week from now. Dr. Jones, are you available to start?
I am here.
All
Thank
righty.
you. Good afternoon or good evening, everyone. School actually starts on Monday, so we don't have a week. We have about 4 or 5 days left before our children will be returning. Um, Today, I just want to discuss Prince George's County Public Schools policies relative to communicable disease prevention and management. One of the first things that we encourage for everyone is hand washing, not only for our students, but also for our staff. Our nurses actually are required to conduct training on hand washing for our students upon their arrival to school. So in the first week or two, they will be offering educational sessions to our students. We also encourage parents at this time to make appointments when visiting our buildings. We follow CDC guidelines as it relates to individuals maintaining a space between others whenever possible. We encourage our staff and our students not to share any personal items, including utensils, school supplies, and any type of clothing. Our schools are cleaned on a daily basis. Each school has an ionized spray machine that is used at the end of each school day. In addition, they have daily sanitizing and disinfecting that will occur daily and as needed. That includes wiping off all desks, doorknobs, railings, and any other high-touch surface areas. Our bathrooms are cleaned as well on a daily basis. We encourage our students to remain at home if they are ill. On our website, we have a document entitled "When to Keep Your Child Home." That is one of our biggest prevention methods, is to have parents keep their children home when they are sick and not send them in. If we do have a case where a child or staff or an individual is symptomatic, we place them in a room which we call the CARES room. It's really an isolation room. We just named it CARE so it would not stigmatize the students and they would not be teased if they were told they had to go in an isolation room. So they are to go into an isolation room. They must wear their mask at all times. They will be sent home. Parents will be contacted and they will be sent home. They will be asked to take their child to a provider. The child will not be able to return until they are cleared by a provider. In the meantime, the children that remain in school, if they are a positive case of monkeypox, they will receive a letter to all of the students that are in their class and to all of the students that they ride the bus with. And the letter will, in summary, indicate that there was a positive case. We do not mention any names for reasons of confidentiality. They are then told what symptoms to look for and provided some anticipatory guidance, such as see your provider if you see any of these symptoms, possibly get tested. However, they can remain in the building unless they are symptomatic. If we have a child who is just symptomatic, we treat them as though it was a communicable disease, because nurses are unable to actually diagnose students. We will send the student home and ask that they be seen by a provider so that we can ensure that they receive the proper care. We've been proactive. I actually am meeting with all of the principals to educate and review our communicable disease protocols. They will be given a PowerPoint presentation on monkeypox as well. And I think that's about it. Thank you.
All right, thank you, Dr. Jones. We appreciate you very much. And yes, you're right. We only have less than a week left until school again. Wow. All right, so many of you have been putting your questions into the chat. You will notice that our great team behind the scenes has been answering those questions for you, Delia Williams, Ania Jordan, and Sono Kanate. And so if you don't see your question asked or answered, let us know, but we will have, we are going to answer 2 questions live right now. Ania or Delia, are you available to do that?
Yes.
Sure. Oh, go ahead.
The first question I have is, please talk about the intradermal method. Is it administered in the forearm?
This is Dr. Carter. Yeah, instead of, there are 3 ways to give an injection. One is to give it subcutaneously. And I know you all have seen that where they make a wheel on your, you don't have to even give that in the forearm. You could just put a wheel on the hand. Well, that's not what this is. This one is deeper than a subcutaneous, but not as deep as a muscular injection. But it still goes into your arm. It just goes at a different angle. When you're doing the muscular injection, you go straight in. When you're doing a intradermal, you go at a 45-degree angle. And when you do a subcutaneous, you go at an even lesser degree angle. So you'll just see it won't be fundamentally different. It's just that there's a different angle that has to be taken. It'll still go in your arm. And it's just like any other shot that you get.
All right, thank you, Dr. Carter. I think we have another question about PCR waste testing. Ania, go ahead.
Sure. The question was, it seems monkeypox digital PCR waste testing mirrors monkeypox clinically. With the limitations of available testing, is waste testing being considered?
No, it's not at this time. And the reason for that is that, as I stated earlier, it's only 15,000 cases in the United States right now. And then when you start to pare it down into communities, it gets to be in the hundreds. So it's expensive to do. Well, it's not really cost effective to do that. Now, unlike with what, for instance, when we were looking at COVID. And it's true that when you're looking for diseases that may not be, you may not see in globally, like for instance, like polio, you may not see it until you see until you do wastewater testing. There are several reasons why wastewater testing for monkeypox is just not a cost-effective way to do it. It's not that you can't, but right now it's just not enough cases and it's just not cost-effective.
Okay, and Dr. Carter, speaking of intradermal, how many doses? It's still the same amount of doses for the individual, correct? 2 doses?
Right, it's the same amount of doses. It's just more doses per vial. We got
Right.
5 doses per vial instead of 1 dose. But yes, you still get the same. You do it with the same 28 days between the 2 doses.
Got it. Dr. Jones, I see a question that I will press answer live. Are infected students able to perform their school lessons virtually while at home during isolation and recovery?
Well, I will be honest. I am a nurse. I am not a educator. However, I am in conversations with the academic side to determine next steps for those individuals who are positive and must isolate.
Okay. Thank you very much. Ania or Delia, do we have any additional questions we should ask? Do you see?
Yeah, I have a good question for you. It's not even a question. It's back to you, George. Can you please just repeat the number for the county to inquire about vaccination availability?
Sure, that number is 301-883-6566. 301-883-6566. And again, our website is health.mypgc.us/monkeypox. All right, any other questions we have here?
There's a question here, George, that I think is interesting and important. It's if you do get infected, would you treat the skin the same way as when you got childhood chickenpox with calamine lotion, oatmeal soak, etc.?
The answer to that is yes, you would, because it's not. Now keep in mind that monkeypox is completely different than chickenpox. Chickenpox is a completely different virus than monkeypox, but the lesions will hurt and itch. So yes, you would do it. You would use the same topical treatments that you would if you had chickenpox, and you would also talk to your doctor, because if you have a lot of them and really painful, they may have to put you on a topical steroid. It depends on how the doctor feels that the monkeypox lesions have expressed on your body, etc. But yes, you treat it like any other. When you have a rash like that, you really do want to try to treat it topically and decrease the itch and pain as much as you can.
All right, I see another question. Dr. Carter, don't go far. Can monkeypox be transferred via insect bites like the West Nile virus?
No, it can't be transferred by insect bites. It's transferred by close, intimate contact. It takes a lot of virus, that the intimate contact causes a lot of virus to be transferred. A mosquito would not be, number one, a mosquito primarily is drawing blood out of you. And if you have a person who does have monkeypox in their bloodstream, that mosquito wouldn't be able to get enough viral load to make a difference. So no, they can't now, but there are animal to human transfer. And so so a lot of times people ask, can my dog get it? Well, yeah, your dog can get it. But it's rare. It doesn't happen all the time, but it can happen. So, that's if you have a person who has monkeypox and they have an animal in the home, that person can transfer monkeypox to the animal. So, but that's rare. I just want you all to know that's rare. We're talking about rare occurrences.
And Anita and Delia, just cut me off if you have another question, but I see one that might be interesting to many. Dr. Carter, can you answer the question of, can you get monkeypox more than once?
Now that's interesting. The answer is obviously yes, because well, it's not obviously yes. The answer is yes, but it depends on your immune state. Now, people who are immune compromised, of course, you have to be very vigilant about them getting any viral illnesses, because they can get it repeatedly. Most people who get a viral illness like monkeypox, you have it one time, you typically stay immunized to it for a very long time. I don't know the length of time you can stay immunized to monkeypox, but just like any other virus, as you get older, your immune system, goes down, and then you get more susceptible to getting it repeatedly. Typically, you don't get monkeypox within a year or two, but I don't know. I will tell you, I don't know what that time is.
All right, thank you, Dr. Carter. Delia has a live question to ask.
If you have COVID-19 and become infected with monkeypox, is there a greater threat of death/risk?
No, it's not. It's not a greater threat of death. Well, the COVID will run its course, and monkeypox will run its course. It won't, but being infected with COVID won't make you any more, it won't make you more susceptible, but it also won't make the severity of the illness of monkeypox more severe. Monkeypox will run its course and COVID will run its course.
All right, thank you, Dr. Carter. We have some questions about the vaccine, the pox vaccine. What can you tell us about the health risks of the vaccine? And we haven't really heard much about these vaccines because it's just not been in the vernacular. So can you tell us what you can share about the safety of the vaccines?
Well, the Jynneos vaccine, the reason we say it's safe because it has the same safety as most safe vaccines, meaning that it's safe. However, if you're allergic to vaccines, then for you have to be careful because you're allergic to vaccines, the substance that allows a vaccine to enter your body. A lot of people are not a lot of people, but there are people who are allergic to vaccinations. They have to be careful. But in general, this is a safe vaccine, meaning that when you look at the studies of this vaccine, you don't see major side effects, like, for instance, any problems with your heart or blood clotting or anything that would make one think that this would be not a vaccine that you wouldn't label as safe. And of course, it went through the same committees that through the FDA and approval by the CDC as all vaccines do. And that's how we can confidently say that it's a safe vaccine.
All right, thank you, Dr. Carter. Ania has another live question that any of the panelists could answer. If so, they please. Ania.
Sure. Do you feel that monkeypox will have an effect similar to COVID in schools?
The answer to that is no. I don't think monkeypox will have a similar effect as COVID. COVID right now in the world, there has been about 500 million cases of COVID in the world since COVID came. Monkeypox, however, the number of cases is much, much less. And if you look at the same periods of time, you'll see that the spread is much, much less for monkeypox. That's number one. Number two, by the CDC and the state and us taking mitigation measures early, we're going to be able to slow monkeypox down even at the rate it is going. And everybody is working really hard to keep it out of the pediatric population. Now that we're trying to make sure that people get educated to monkeypox so that it can stay contained. And I will give the community where monkeypox is spreading credit because they are being very, very vigilant about not getting this virus spread like it could spread. It's been very, very good over the last month or two to see that it's still contained in one community. I think in the United States, there have been maybe 4 children out of the whole 15,000, almost 16,000 cases that have been positive for monkeypox. And those have been special cases. So it's really not penetrating the pediatric community like COVID, because COVID was a respiratory virus was fine particles that could spread easily. You could see how children get colds, that you can see how that could spread quickly. But monkeypox, you have to have skin contact. You have to have intimate contact. And even when it comes out in droplets, you literally have to be kissing somebody or spraying in somebody's face for it to happen. So we don't anticipate that monkeypox will spread in the school system like COVID did.
And Dr. Carter, perhaps could you expand a little bit more on the large droplets, because there's a difference from being, very close to someone's face and hugging, kissing or whatever for a prolonged period versus if you're in the same room with someone and they may happen to sneeze, even into their arm. There's a big difference there, correct?
Absolutely, because those large droplets have a person who has monkeypox, if they sneeze and they sneeze into their hand, that fluid that they just sneezed out has a lot of monkeypox virus in it. But it doesn't go across the room. It won't be because monkeypox needs a lot of fluid to stay viable. So it doesn't spray out like when COVID spreads, it spreads like cigarette smoke. If you're in the room with somebody, you smell the smoke, you can smell that smoke has gotten all the way over to you. When COVID spread, it spreads like that. But monkeypox just spreads in that little local area where you sneeze, in that radius. That's it. Not all over the room, and it spreads like because doesn't spread by fine particles. So that's why you have to be very close to somebody to get it. Now, if they sneeze onto a surface, that surface needs to be cleaned. Now, people ask, well, how long does monkeypox stay on a surface? I haven't found good evidence the length of time that could be, but it could be a prolonged period of time, 15 days in some studies that I saw. So we go back to making sure that people understand, clean your surfaces. Make sure surfaces are clean. But there's not a lot of surface transmission with monkeypox. Most of the monkeypox is skin to skin. Most of those surface transmission studies are found in within people's homes, with people who have monkeypox and the other people in the home, and they find that it's spread by surfaces. But it doesn't. I haven't seen too many studies that say that happens in the general public. Mm-hmm. It may, of course it can, but I think that's low probability.
And staying with the spread of monkeypox, we've seen a number of questions in the chat about can one catch monkeypox in a swimming pool? Perhaps if you're, based on me talking to you a lot, Dr. Carter, recently, really, if you have close contact and touch the sores with someone in the swimming pool, sure you can. But in the general sense, Dr. Carter, what do you say?
No, so you'd have to be in skin-to-skin contact with a person in the swimming pool. But if somebody with monkeypox jumps in the swimming pool and then you jump in after it, the probability of you getting monkeypox is very low, because monkeypox doesn't spread won't spread through a chlorinated pool. And a lot of viruses won't. That's one of the reasons that we do pool inspections and make sure these pools are adequately chlorinated. Monkeypox won't do that.
And the last town hall, Dr. Carter, you talked about some of the things that you would suggest if you're traveling, staying in a hotel. What are some of the things that you do to make sure that when you go into a hotel room, for instance, what are some of the things that you practice? I
wipe down all the surfaces, George. I make sure when I go into a hotel, I take some Clorox wipes. I will say my wife takes the Clorox wipes. I won't lie. I'll have to be honest, but she makes me wipe down all surfaces. And not that it's just good. It's a good public health practice. It's a good self-protection practice to do that. So, because even though the hotels tell you that they did wipe it down, it's still for your peace of mind and your regular practice, you should wipe down all the surfaces. Now, I don't go and wash all the sheets. I don't do that because because it's in order to get monkeypox from sheets, you would have to literally get in the sheets after somebody who had monkeypox just got out of them. If they took the sheets and they washed them at all, you've eliminated the monkeypox virus. So I don't wash the sheets when I go into a hotel, but I do wipe down all of the surfaces.
All right. Okay, it is 7:19. We have about 10 minutes left. If you have a question you'd like to ask, put it in the chat and we'll see if we can answer it. Dr. Jones or Dr. Carter could come in on this one. We addressed this a little bit in the last town hall, but what do we think about contact sports in schools with monkeypox or any communicable disease?
Well, I guess I'll take part of it, Dr. Carter. You can take
Okay,
the other
yeah,
part.
Go ahead, Dr. Jones.
So part of with monkeypox is prevention. And so we have to educate not only our students, but also all of our staff. I will be meeting with the athletic directors and providing them a presentation on monkeypox prevention, hand washing. They will be instructed to make sure that they wipe down or have the students wipe down all equipment in between students using it. Wrestling, they have to wipe off the mats between each student using it. The coaches will also do a verbal questionnaire for the students. Do you have a fever? Do you have any headaches today? Do you have any rashes today? Just to make people more aware. And if any of those things are present, then the person would not be able to actually practice. So we are prevention. We are trying to make everybody, much more cognizant of making sure that they wipe down items in between students.
I think that was great, Dr. Jones. I think that's exactly right. I mean, and the pre-screening of students before they participate in any skin-to-skin contact sport is really important to make sure they don't have a rash or any symptoms. Because if they don't have any symptoms or a rash, then they're not transmitting the virus. So the schools have been very good about that and hypervigilant since we've been doing, since COVID and now with monkeypox. I think that the schools have been very good at making sure that our students are protected.
All right, great.
And I also want to add to that, Dr. Carter's office and also the school system, they work hand in hand. If one has a question about the other, we're really good about connecting and collaborating to make sure that our students are safe.
Thank you, Dr. Jones. You might be answering this one from Ania. We have another live question.
Yes, what would be considered a monkeypox outbreak in schools?
Well, right now, they haven't defined it. We usually take guidance from the state and the CDC as a monkeypox outbreak. They haven't said. Typically, if you have one person, we have one kid with the monkeypox, you would think it would be very difficult to just say one kid is an outbreak. So they would have to define that in terms of how many children in a cluster who would have tested positive for monkeypox would be defined as an outbreak. I doubt if it's one, but if it's two, then I think that probably would be defined as one. But I would bow to the state and the CDC on those definitions.
Okay, we have 7 minutes left, so we might be able to answer just a few more questions. Dr. Carter, could you explain a little bit more about how the intradermal method of vaccination will help increase the supply of doses and eventually allow us to expand the eligibility a little bit?
Well, when vaccines are first created, typically vaccines, you want to give a vaccine into a muscle. That's what when vaccines are first created, they create them so that they're intramuscular. And when you put it in a muscle, typically you get the best immune response by putting it directly there. However, there are some vaccines, if you don't put it in the muscle and you put it in a layer just above the muscle, in the intradermal layer, you can also get the same response. And so because this particular vaccine was started out when they came out of the gate, they did it with doing it intramuscularly. But then they tested to see whether or not you would get the same response if you put it in that layer above, that intradermal layer. It turns out that you got primarily the same response. So that made the FDA approve doing the injection instead of doing it intramuscularly, doing it intradermally, because you use less in the intradermal layer than you have to use in the muscular layer. Now, the science of that, I can't tell you because I'm not on top of that right now. So I think that we'd have to get more experts on. But that's sort of the high level explanation about how that worked. And when they looked at the study, they found that if you give it intradermally, you get the same response and with a lower dose. So that's very helpful to us in terms of getting this particular vaccine out.
Right, and as the state, gives us more vaccine, and we do more intradermal, which is starting next week, that availability will start to increase quicker than it was now.
Mhm.
Better say, Doc?
Yes.
Yeah, okay. All right, so we have 5 more minutes left. Let's see what other questions we have. Ania, I feel like we already addressed the intradermal one. And I see some of our behind the scenes folks are answering questions. Let's see. How about precautions when shopping and trying on clothes, Dr. Carter? I know we addressed this a little bit last time.
Right. And you're not at high risk of getting monkeypox when you're shopping and trying on clothes. And for the most part, it's if somebody with monkeypox came in, tried on some clothes, and you came in right behind them and put some clothes on, there's a possibility of you getting monkeypox. That's no getting around that. The probability that is low is because most people in the general public do not have monkeypox. It's very few people who actually have it. But there is a possibility that could happen. So you can't say not that couldn't happen. So I think that's as much as I can say about that. In the grocery store, I think it's the probability that's even lower. However, if somebody sneezed on a surface right before you, who had monkeypox, and you came right after them and you touched that surface and got it on you, it's theoretically possible for you to get it. It just, that's not the way it's been transmitted in the country now and even in the world. There are not cases of that showing up, but it's still possible. So I don't want to say it's not possible.
Right. And that's why the general public is still at low risk.
Right.
Contracting monkeypox if you're not, if you're in the general public. All right. And last one, Dr. Carter, COVID came out of nowhere. And now we're hearing about monkeypox more than ever before. So some folks are asking, did monkeypox just pop out of nowhere? How did we come to this point? You don't have to go too detailed, but give us a sense of how you can answer that.
No, monkeypox. In 2005, there was a monkeypox case in the United States. It didn't come out of nowhere. Monkeypox is prevalent in Africa, in West Africa, and in Central Africa. It's spread by some rodent-like creature and it's spread from animal to human and then human to human. It's not that it hasn't been around. That's why we know about it. And we know its characteristic, like we know it's part of the orthopox family, the same family that smallpox is in. We know that, we know a lot about this. We had the one vaccine that was okay for it, like the AMCON 2000, but we were able to develop a vaccine very quickly for this. There's already a vaccine to be able to, because we know a lot about it. So it's not coming out of the clear blue sky. However, it got in a community that has a lot of skin to skin contact, and so it spread. That's the way polio spread. Polio is a virus that's in that likes to live in your intestines, and it goes from your intestines out. And among children, you have to change diapers and stuff, and you're touching it, it's an oral fecal transmission. So that's how polio had to spread. It finds a way. But once we get it mitigated, like with polio, we were able to stop its spread. it crops back up in the world periodically. Right now, like for instance, if you go to Afghanistan, there's polio in Afghanistan. It's endemic. Viruses show their ugly heads when they can find a way to live, in a community that's unvaccinated. So having said that, monkeypox found a community to live in, and that's how it's spreading right now. But it's not, and with the COVID and people staying inside and the close contact that resulted because of people were tired of staying inside, it would be a natural way for for monkeypox to find a way into communities. So I would just say that it's not unusual, but it probably is secondary to the fact that we were inside for so long with COVID, and we came out and everybody is in the mood to be able to do contact. And I'm guilty because I'm hugging people all the time, and, so and I know I have to be careful too. But I just think it's a natural result of having been isolated from COVID for so long.
All right, Dr. Carter, thank you so much for answering most of the questions this evening. We appreciate your stamina. Thank you, Dr. Tracy Jones from the Prince George's County School System. And thank you to Henry Bishop from the Health Department's HIV STD program. We are at time, ladies and gentlemen. Thank you so much for joining us. On your screen now is the monkeypox call center number. Take a screenshot real quick if you want to. 301-883-6566. A good number of the information we talked about tonight is in that number. And we really hope that everyone stays healthy, stay vigilant, help inform your communities and your networks. And thank you so much, and we'll see you around. Have a good night.